Okay, there's a link between autoimmune disease and heart disease. So Dr. Marc's going to tell us all about it.
Around 27 million people are living with autoimmune disease, and most of them are women.
We know that coronary artery disease is inflammation, and autoimmune diseases also have a lot of inflammatory biomarkers.
Dr. Heba Wasif is director of Cleveland Clinic's Cardio-Rheumatology Center. Dr. Wasif's team found that women with autoimmune disease, specifically lupus, rheumatoid arthritis, and scleroderma, have a higher rate of death from heart disease and stroke than men with the same conditions.
People who have autoimmune disorders have a very high prevalence of the risk factors for coronary artery disease, and some of these factors are also very accentuated. So, for example, people with rheumatoid arthritis who smoke have worse rheumatoid arthritis activity. And there's higher prevalence of hypertension, there's higher prevalence of hypercholesterolemia. All these are risk factors for coronary artery disease. But it's beyond the coronary artery disease. It's not only that patients are at risk for coronary artery disease, they're at risk also for valve disease and for heart failure.
Researchers looked at the CDC's database, and they found that of 300,000 deaths in patients with autoimmune disease, a third of them were due to cardiovascular disease.
The question is, why is there discrepancy? And this study was not intended to answer that question. It was looking at trends. And I can speculate, but I can't give a definitive answer why there is a difference. Patients with autoimmune disorders have high prevalence of microvascular disease, for example, and I don't think that that's the definitive answer, but it's just one of the answers why there may be discrepancy. And usually patients with microvascular disease, meaning that they don't have disease in the big blood vessels of the heart, they have disease in the small blood vessels of the heart. So if a woman, for example, with lupus would complain of chest pain, she gets an angiogram or a CAT scan, there's no coronary artery disease, then they're told that they don't have anything. But they truly may have actually microvascular disease. And that would not show up on an angiogram, but it will show up on other imaging trial, or if you would do a very specialized angiogram called a cardioreactivity testing. So that may be one of the explanations, but it's not the entire explanation, because what we don't know is, are these patients treated differently, meaning are they on the same risk-modifying agents, or meaning that are they on statins, are they getting appropriate therapies for their hypertension, are they getting appropriate therapies for their cholesterol? This study did not answer any of these questions.
Research continues in this area. For Fox 8, I'm Dr. Marc.
Dr. Marc is sponsored by the Cleveland Clinic.